Hi everyone, welcome. We're going to give a few more minutes for people to continue to log on. So we'll be starting around 1:04. Thanks. Thanks for joining. We're going to start in about 2 minutes as people continue to log on. Hi, welcome. So, Happy New Year, everyone. Thanks for joining us today for this webinar to update you all on the work of the Waiver Reimagine. We are excited to see so much interest here. Our webinar registration actually maxed out at 1,000 registrants. We might have set a bit of a record for our division here. My name is Adrienne Hannert, and I'm a project manager with the Disability Services Division, working on the Waiver Reimagine project. Today we have our interim director of Disability Services Division here, Heidi Hamilton, to start us off. Heidi, do you want to say a few words?
Hi, everybody. Good afternoon. As Adrienne said, my name is Heidi Hamilton. I am the acting director of the Disability Services Division at DHS. And I just want to say welcome to you all. I am so excited that so many people are interested in this project. It's a really exciting project from our perspective. And it's really an example of how our division is really listening to people in the community. We heard that The waivers, as they were very complicated and difficult to understand, not very equitable across our populations. And so this work is to really make the programs easier to understand and also more equitable. And so I'm just really excited that you all are here to listen, to hear how the project is going and to get updates. And I'll turn it back over to Adrienne. Thank you all for being here.
Thank you, Heidi. So I'm going to start us off just giving some background on how we've arrived at this point. So as Heidi referenced, Minnesota's current waiver service system was developed, one piece and one program at a time over the course of many years. So disability waivers were developed around diagnoses and criteria for institutional care. So as waivers were added and evolved throughout the years, they became increasingly complex. So different services were available on different waivers, and different names were given for similar services. So these variations in the waivers also created inequitable access to services for people. And we've heard from people and families that Minnesota's disability waiver programs are complicated, inequitable, and limit flexibility. So Waiver Reimagine is what we're calling the ongoing system level work to address these issues. So through Waiver Reimagine, the waiver program structure will be reshaped and will transition to an individual budgeting model for people who access disability waivers. These changes will link a person's individual needs to the amount spent in their service plan. And service and supports will align to a person's needs when implemented and not their diagnoses. So we hope that through these system level improvements, the Waiver Reimagine work will both make it easier for people and families to describe the services that they want and allow for better information about services and budgets so that people have more choice and control over planning their services and supports. This work will also provide equal access to services and funding across waiver programs, regardless of a person's disability and regardless of where they live in Minnesota. So additionally, these improvements will increase options for a person to self-direct services and to use technology and remote supports as alternative support options. So we've divided this work of Waiver Reimagine into two phases. In 2019, the Minnesota legislature authorized the Department of Human Services to make system level improvements to Minnesota's disability waiver programs, starting with simplifying the waiver service menu, so bringing like services together across the 4 waivers. We called this Waiver Reimagine Phase 1. This work began to be implemented in January 2021 on a rolling basis during the reassessment process. So on this slide, there are some examples of how common services were brought together. So phase 2 is the phase we are currently in. The work and the goals in phase 2 are to reshape the waivers from 4 waivers based on a person's diagnosis to 2 based on where a person lives. This phase also includes the implementation of individualized budgets. So Leah Zolakevich is a waiver policy consultant at DHS, and she's going to talk to you next about the work of reshaping the waivers, followed by Megan Lindblom, who's a supervisor in our program integrity area, who will explain more about the individualized budget work. So after Megan's finished, we will review some FAQs and determine if there's time for taking questions from the Q&A function that we've got here. However, given the number of attendees we have here, we hope you understand that we're unable to go into some detailed questions or specifics about people's individual situations. And we really encourage you to connect with us via email that we're going to provide for you after the webinar with more questions or thoughts on this. Thank you, and I'll turn it over to Leah.
Hello, great. Thank you, Adrienne. Again, I'm Leah Zolakevich. I work on the waiver policy and compliance team, and I'll be talking today a bit about the history behind reshaping the waivers and what we've done so far, as well as plans for the future. So just on your screen, you're going to see what our plans are, but I just wanted to take a step back and talk a little bit about how we came to be to this place. So over nearly 4 decades, the Disability Services Division and disability community has largely moved away from the narrow diagnosis-based care model to being more person-centered with flexible services to meet a variety of needs. The services and supports a person needs are not dictated by their clinical diagnosis alone, and people with the same diagnosis may lead very different lives. So we're moving toward a more person-centered waiver system by transitioning the 4 current disability waivers to 2 new waivers that will align with where people live. So this slide shows the 4 current disability waivers on the left-hand side, which includes the brain injury waiver, the community alternative care waiver, the community access for disability inclusion waiver, and the developmental disabilities waiver. As you can see, and some of you are familiar with, the elderly waiver is not included in this project right now because there is only one waiver for elderly waiver. So this is an effort with our disability waivers to combine and consolidate. So then there's an arrow pointing to the right, and there are 2 boxes showing that we are planning to reshape our waivers from 4 into 2. We don't have a name yet for the waivers. We've had some placeholder names, but we're working with stakeholders on names for the 2 new waivers that can really describe what they are so people can have more information to be able to make choices and decisions. And so the 2 new waivers right now, let's call them waiver 1 and waiver 2. Waiver 1 is for people living in their own home or family home, and waiver 2 is for people living in provider managed residential homes. So again, let's take a little bit of time to talk about why 2 waivers. In 2017, the legislature asked DHS to conduct a study to identify improvements to our 4 disability waiver programs, including reducing the number of waivers. To begin, all different models were considered, including creating additional waivers, consolidating waivers, and also one unified waiver. Additional analysis and stakeholder feedback showed that fewer waivers made more sense, and it was determined to move forward with combining our disability waiver programs into a 2 waiver system, or having 1 unified waiver. So we explored this a bit more, and after several years of researching other states, revising federal laws, reviewing existing systems and policies, soliciting stakeholder feedback, we proposed to the legislature to reshape the 4 disability waivers into 2 based on where a person lives. The Minnesota legislature decided on and approved this change in 2021. And in the future, we may consider paring things down even further into 1 unified waiver. However, we really need time to monitor, evaluate, and make adjustments in a targeted manner at this point. So again, we get asked the question, what are the benefits of having a 2 waiver system? Well, our hope is that it will allow for greater flexibility in future program changes and enhances program integrity. Simplification will minimize ways for fraud, waste, and abuse to occur. Both of the new waivers will encompass all 4 levels of care and other eligibility criteria associated with the 4 current waivers. So as a result, eligibility requirements will essentially remain unchanged for people who use services. This is intended to create unity between the 2 waivers and increase equity. Next slide, please. Wanted to share with you today we're calling them eligibility scenarios. So you're asking the question, how do I fit in to these new models of waivers? There's some examples here that I wanted to share with you about waiver 1. So again, waiver 1 will be that waiver for people who live in their own home or family home. These examples are simply examples. It's not an all-inclusive list, but we just wanted to provide some information about some different examples that we know of to see where, and you could see kind of where you would fit into the new structure. So one example is a person living with their family, and they have a community provider come in to provide assistance with meeting their goals, support them in the community. There could be a second community provider who supports the person in reducing unwanted behavior. Another example is a person is living with their family and self-directs their activities of daily living care needs. Their parents assist with hands-on care for bathing, dressing, and grooming, but then the family also hired staff to assist with community activities and transportation. The next example is a person lives in their own apartment. They have a community provider come in weekly to help maintain the home and do some heavy housekeeping. The person could have another community provider that comes in twice a week and helps them with budgeting and finding activities in the community. A couple of more examples that aren't listed here, but wanted to provide them to you. Person could be living in an apartment and has a roommate. The person and their roommate share chores like cleaning and grocery shopping. The roommate provides some formal supports for the person to assist them in meeting their goal of learning how to cook a meal from start to finish independently. The person could have transportation needs, and that supports their roommate could provide as transportation and helping them learn how to get around in their community through the public busing system. And lastly, another example is a person is living with their family and has a nurse to help them with complex medical needs. Staff from a different provider could come into the home weekly to help with house cleaning and general household management tasks. Next slide. So those were examples or scenarios of waiver 1 eligibility. The next set of scenarios described are related to provider managed or shared living models where more than one person with disabilities live in a setting. So for waiver 2, there may be shared staffing in all settings. There may be shift staffing. People living in one of these situations would more than likely have awake, asleep, overnight staffing, or possibly remote overnight staffing. So some examples are a person lives in a family foster care. They have foster parents who assist with transferring, dressing, bathing, and grooming. That foster parent also supports the person in accessing the community by helping them schedule activities and driving them around to places and events they would like to attend. A person lives in a corporate residential setting as another example. There are shift staff who come into their house. The person has several roommates. The person has supports around unwanted behavior due to positive symptoms of schizophrenia. And they have a difficult sleeping through the night, and there's always a staff person available, awake, available to assist and support them. Another example is a person lives in an assisted living in a one-room suite with a kitchenette. There are many other people in their building in a shared common space, including a full kitchen and family rooms. The person needs support from staff with transferring, walking, grooming, bathing, and dressing. The person needs transportation arranged by their staff. And again, this is not an exhaustive list. We know there's lots of other scenarios out there, but this was an effort to help you sort of conceptualize and start thinking about where might a person that I'm supporting fit into this, or where might I fit into this new two-waiver structure. Next slide, please. I just wanted to share with everybody that, Waiver Reimagine is a multi-year project. And we've completed phase 1, as Adrian had mentioned. We've done a lot of work related to some of the phase 2 effort, and we'll be continuing on to do more work over the next several years. So there are 6 major policy areas that are impacted by reshaping the waivers or bringing the waivers from 4 to 2. We will need to define the 2 new waivers by name and description. We've started some of that work, but still have some work to do. We need to identify a service menu for each of the 2 new waivers. We have to develop policies and processes for moving between the 2 new waivers. We need to determine the future of residential habilitation, which is a requirement right now under the DD waiver, but without a DD waiver, what would that look like? We are needing to develop policy around expanding self-directed services for people living in provider-managed residential settings, as self-direction is only available right now under the waivers for people living in their own home and family. Case management qualifications in a 2 waiver system is also something that we need to talk about. When there are qualifications right now currently for each of the 4 new waivers, and what will that look like when we streamline into 2 new waivers? So those are the main policy areas that are associated with reshaping the waivers that over the next couple of years, we're going to need to nail down policy and processes along with our partners and stakeholders. Next slide, please. So let's talk a little bit about the work we have completed in, I'm going to say 21 and 22, because we have completed quite a bit of work over the past couple of years. Stakeholder engagement has really been a significant focus of the work that we've completed over the past 2 years. So let's talk a little bit about those different engagement efforts. So we distributed a survey to lead agencies in the summer of 2021 to seek input on the transition from 4 waivers to 2. We got 220 responses from the survey, and some themes that the survey included were, some things that were concerns of lead agencies and some information about, these changes are very positive, but let's think about XYZ. So we learned a lot. Themes included moving from one waiver to another could limit access to waiver services like waiver caps, limiting eligibility, setting criteria too high. So that's one thing that we're going to have to work through. It could potentially increase administrative work for assessors and case managers, needing for a new assessment, the waiver exit process, new support plans. So again, working with lead agencies to make sure that what we're building is more efficient and more streamlined and not increased administrative work. There could potentially be a loss of expertise when caseloads are not diagnosis or waiver specific as they are now. So that was a concern also brought to our attention from this survey. And then the removal of habilitation would be much more person-centered. However, there could be some concerns around provider accountability to work on goals resulting in a decline of skills, development, and maintenance. So that's just a little bit of a snapshot of survey results. We also, this was a really big lift in this past year in 2022, the Waiver Reimagine Advisory Committee was formed. So we appointed 33 members from various backgrounds to provide input on the continuing development and implementation of Waiver Reimagine. The first few months of meetings in 2022 were used to educate members on the current system. We had to do a lot of that sort of level setting to make sure everybody was on the same page so they could really start advising us on changes. So work on reshaping the waivers so far includes recommendations on names of new waivers, waiver eligibility descriptions, some of which we spoke about earlier. And in December, the group started to work on recommendations for the service menus for the 2 new waivers. In April, there were 2 focus groups held regarding residential habilitation requirement for people accessing the DD waiver. The purpose of that those focus groups, was to seek input on the future of residential habilitation as an eligibility requirement. So some themes from that are that people on the DD waiver like that this change will make residential habilitation a choice and not a requirement. The change will standardize requirements and reduce paperwork. And a concern was, again, that possibly there could be some lack of incentive or motivation to have goals, especially in provider managed settings. The last thing that we did as far as surveying and focus groups goes is we had a statewide survey conducted in July of 2022. So this was sent out to all stakeholders by many different means. And we, again, were seeking input related to the transition to 2 waivers, asking some targeted questions about the different policy areas that we talked about earlier. And so themes from that included just this high need and expectation for training on how changes result from Waiver Reimagine to operationalize for success. And as some of you recall, when we were implementing phase 1, or that streamlined service menu, the common service menu, we had open office hours every Friday for a year. We will take a very similar approach as implementation becomes near and as we are in the midst of implementation on this work. There is also a high need for community engagement in the development of policies. And again, we are going to be focusing a lot of our work this year in 23 on community engagement efforts. There's also a high need for real reform and simplification of procedures, processes, and policies. So, and then the last thing that I wanted to make mention is some development of resources in the Disability Hub. And so the Disability Hub is a free statewide resource network that helps people solve problems, navigate the system, plan for their future. And to date, our team, the Waiver Reimagine team, has partnered with the Disability Hub to develop some more resources specific to Waiver Reimagine and specific to waiver, is a waiver right for you? So we'll continue to add more resources to the Disability Hub and promote those resources as they continue to be developed. Next slide, please. The last thing that I'm going to talk about is the work, again, planned for 2023. More community engagement. We are going to focus a lot of effort on developing a communication plan and implementing a communication plan that takes into account the different communities engaged with disability services. There will be opportunities for people, families, and advocates using virtual events, surveys, and the Disability Hub virtual insight panel. There will be opportunities with lead agencies through standing meetings such as MAXA and County State Work Group meetings, the Tribal Long-Term Services and Supports Work Group, regional meetings, etc. And there will be ad hoc meetings with lead agencies, including specific focus on tribes currently administering the waivers. There will be additional statewide survey opportunities that will allow all community members, all people who live in Minnesota, to provide feedback and inform policy decisions. And we really need to do a better job at connecting more with people using services with a focus on racial and ethnic equity and engagement. So we'll also be focusing a lot on that. Additional work is needed to increase engagement with all people receiving waiver services. We'll be using non-traditional methods such as oral feedback through listening sessions, translating documents, and having interpreters available to help engage in their primary and preferred language, as well as other strategies. And then again, we'll continue to enhance Disability Hub resources and make that information available to people as well. I am going to pass it along to Megan to talk about individual budgets. Megan?
Thank you so much, Leah. Just as a reminder, hi everybody, my name is Megan Lindblom. I'm the Program Integrity Supervisor here at the Disability Services Division, and my team is in charge of the individual budgeting portion of Waiver Reimagine. So that's what I'll be talking about today. I am going to keep a lot of this brief, and there's going to be really detailed information I won't go over on every slide. But before I do jump into that, I want to take a moment to remind you, we have a link at the end of the PowerPoint, and we can put it in the Q&A as well. But the Waiver Reimagine website is a great resource. We have a ton of published information, a lot of which goes into really grainy details on the stuff that I'm about to talk to you about. And I think it's just really important to highlight that. So if you're hearing these things and you have questions or you want to learn more, there's a lot of resources out there for you to do some independent work and then connect with us if you have any questions. So I'm going to start us off talking about what the current budget methodology is, because believe it or not, a lot of people don't have a lot of connection to our budget system as it is today. It's a lead agency based budget. And when we say lead agencies, we mean mostly counties, but also some of our tribes are lead agencies as well. And each one of the lead agencies have their own waiver budget where they manage all of the different people who are on the waiver services within that budget. And what we've heard a lot, and I'll echo this, you heard it from Leah, you've heard it from Adrian as well, is we've heard that that's creating a lot of inequities, right? If you walk in the door to a smaller county who has a smaller budget, there's just different levels of access that you can get to than walking to a really big county that has a really big budget. So when we look towards the future to the individual budget methodology, this is really focusing in on each person is assigned a support range budget that's based on the result of their own min choices assessment. And then from there, the person chooses and works with their support planning team to put together a support plan of services and supports within that budget amount. This does mirror a little bit of what we have today in our CDCS budget model. However, it is different, and we'll highlight how that's different as we go through it. So next slide, please. So this is one of those places I'm not going to get into super detail, but I wanted to highlight that when we think about the word budget or individual budget methodology, I think a lot of people, if not everybody's mind jumps straight to how much is it and how much are we getting, right? And I want to stop and pause and say, when we look at it from the DHS perspective and running a system, it's a much more complex puzzle that fits together the criteria, right? How we get to the budget amounts, as well as how do we put together the budget amounts in an equitable way, in an accessible way, and really a transparent way. So when we look at the model overall, there's three really big lanes that you can see on the screen here. From left to right, I have the support range descriptions, which are mostly a education and advocacy tool that allows for people to really understand more wholly the support ranges and what kind of support needs we might see from individuals in any one of those support ranges. And so we will see specificity around a min choices assessment, but also we use Charting the Life course to really look at the different parts of our life. What are the supports someone may need in their employment or in their education, and how is that different from maybe their social life or their spiritual life? The support range criteria is kind of what it sounds like. It's how a person gets into a support range and really driven by that min choices assessment. And we'll talk about that in the next slide. And then service mixes is, I think, what a lot of people really do jump to when they think about a budget model is how much is it? How do we determine that? And what are people getting? And that's really how we have set up a transparent framework to not only determine how much each one of these budget amounts are, but how do we tie them to the services and supports that are available, as well as how much those services cost. So next slide, please. So how is a person placed on a support range, or what we just called in the last slide, the support range criteria? The simplest way to put this is it's a combined score across all of the following assessment areas within a person's min choices assessment. It's their general support need, which is the combination of activities of daily living support needs, as well as instrumental activities of daily support needs, or daily living support needs, as well as someone's health support needs and their behavioral support needs. And all of that goes together to determine a person's support range, right? We're not just looking at a question here, a question there, kind of summarizing a person. we're really looking at a robust scoring of min choices, right? So something I want to drive home here before we go to the next slide is no single question or handfuls of questions would determine a person's support range. Next slide, please. So what do these support ranges, levels, we have lots of words to describe them, look like? And here is our support ranges for adults. And I want to call out here, like I did earlier at the beginning of this section, that there is a ton of information on the Waiver Reimagine website. And one of those pieces of information is more about our child support ranges as well. There are 3 different cohorts based on age, as well as a number of support ranges in each one of those cohorts. So I'm focusing today on adults because they still are the majority of this waiver population. However, we do have specific frameworks as well as criteria and service mixes for kids. So I want to just highlight that if you have questions about the under 18 population, that is included in the resources on the Waiver Reimagine website. What we have though is our adults. There are 7 support ranges, and there's 2 kind of really big lanes here that I want to highlight. If we look at the table on the slide, the first 4 rows, or what on the left side of the table are 1, 2, 3, and 4, are our 4 support ranges that are really driven by that general support need, right? Like we talked about, the activities of daily living and instrumental activities daily of living. And they have a typical, for someone in one of these support ranges, has a typical health and or behavioral support need. Where this becomes a bit more complicated is when we add on the layers of individuals who not only have a general support need, but may have a health and or behavioral support need as well. And that's where we get into those green lines, or the bottom 3 lines of the table on the slide. And on the left side, you'll see L, H, and E. These are really to acknowledge and make sure that we are appropriately addressing funds to the additional supports a person may need when they have health or behavioral needs in addition, sorry, I'm repeating myself, but when those are in addition to a general support need. So I just want to call that out and show that. But again, there's a lot more detail, very in depth in the reports. So next slide, please. So then we talked about our service mixes. And like I had said a few slides back, this is really, I think, when we talk about a budget model, where people go to first is how much is it going to be? How are we figuring out how much is it going to be? And so when we say service mix, what we mean here at DHS is an estimate of the types and amounts of services needed by individuals. And that is specific to support ranges. It is also different for living settings, just like we talked about Waiver 1 and Waiver 2 with Leah. There are different assumptions by living setting here for the budget model as well. And there are different assumptions for adults and children. I think the easiest way to visualize this and share kind of how does this actually work practically would be to look at that visual at the bottom of this slide. And for each one of those support ranges, for those living settings, and for those adults or cohorts of children in different ages, we would be looking to see what the frequently used services are, how much people are using, and what the cost for those services are, which ultimately comes down to the rates for those services. And so for someone who's living independently or with their family, maybe service A is individual home supports. And then we need to look and determine how much of those supports people in that support range and living setting and age would use, and that would be the hours of service. And then we'd have to look at how much they cost. So ultimately, you can calculate out how much the state would anticipate a person spending on those services. And then we'd add the additional likely services in as well. And that would come out to a person's total budget. What I want to make sure is really, really clear here is these service mixes do not dictate service use. It is a standardized way to make sure that we are encapsulating the amount of funding a person may need with similar services within one of those support ranges, but it is absolutely not, here's how much of each service you're going to get. That is not the aim here with this. So, next slide, please. And so next we're going to talk really briefly about a case that helps highlight a few of the things that we get questions about, some of the concerns that we hear from people, and really talk it through. And I want to acknowledge that this is a real case of a real person using Waiver. We've changed the information that is identifiable, but this is a person using a Waiver today. So I want to recognize that. And so we're going to talk about Nick, who is 35 years old, lives with his family at home. He's on the DD waiver and he has high behavioral support and health support needs. So when we last looked at and developed our budgets, it was 2019. So the numbers that you're going to see as I talk through this case are from 2019. And I will recognize that that is a little bit in our rearview mirror these days, and the world has really changed. So as we talk about the future work that we have yet to do, I'll address how we're going to be updating those numbers and when people can expect to see them. But as we talk about these, please keep in mind that they're 2019 numbers, just in case maybe you know your amounts of CSSP or you know cases you're working on and these numbers just don't seem right, okay? So he is using in 2019 traditional waiver and state plan supports. His total spending for all of that is $94,220 on both programs. He anticipates being in the waiver under Waiver Reimagine and being support range E, living with family. And when I say he anticipates, that's where our model has placed him. Under support range E, living with family, his budget would be $87,298. So let's stop and recognize that already we're at a place of probably some anxiety. Nick looks like he's going to have less to spend by about $7,000 or so dollars. And that already is a big place of concern. So let's look at where Nick's spending today and where Nick will be spending in the future. So next slide, please. So to break it down, what services is Nick using? He's using IHS without any trading for about $60,000. He's got some in-home respite, and he's also using positive supports. So his waiver spending overall on the DD waiver is $67,580. He's additionally using state plan services of skilled nursing and PCA for a total of $26,640. So overall, that comes to that $94,000 and some plan. Now, when we look to the next slide, we'll see some changes for Nick. One thing that we want to note, and that is different from the CDCS individual budget model today and what some other individual budget models may be used within the state, is that there are services and supports that are inside the waiver budget, and there are services and supports that are outside the waiver budget. So in this case, one of the services that Nick is using, positive supports, would be outside of his waiver budget. So that would not count towards his limit within the waiver of $87,000, right? So as we look towards this today and the future model that we've got in front of us, we can see that if we look at the middle pie chart or the top left table, that Nick actually has about $22,000 in available spending if he would like to increase or change his supports and services. Because in the new budget model, state plan services will not count towards your waiver budget unless you are using extended state plan services like extended PCA. And there are services that are outside of the waiver budget, like positive supports. So while when we first looked at Nick's numbers, they looked really worrying that he was going to have a decrease. Ultimately, Nick, even with his very high needs, living with his family, does actually benefit from this change in that he has an increased available funds to support Plan 2 if he so chooses. He's not required to use all of those funds, but if he would like to explore new options, he is more than welcome to, and that would be something he'd work with his case manager and support planning team on. Next slide, please. So just to wrap us up here, let's talk a little bit about the work we've got going on the individual budgeting side. Obviously, I went through very high level, but as you can tell, this has been detailed work up until this point. Right now, where we're at with our work is really creating the policies, the procedures, and the rules that will support the transition between the current budgeting model and the future budgeting model. Things like budget management for the state, for individuals and case managers, support planning to a budget, that will be a new thing that we have to undertake here, both for the state and for lead agencies. And budget exceptions, right? No matter how perfect our model is, it will never encompass all of the needs of the individuals on these waivers. And some people are just going to have to be outside of the model, given how they may differ or have higher needs than can be anticipated. We also have to work on developing and updating our systems to incorporate individual budgeting. And that's a pretty big lift. Some new systems will come online for lead agencies. We hope to be working on new systems into the future that will help people have more information in their hands as well. So more to come on that as well. We will be creating trainings and manuals for all waiver stakeholders, including people and their families. And this goes really hand in hand with what Leah was talking about with the hub, making sure that resources are available long before we launch so that people really do have the information and the answers to the questions that they have. So when we get to day one, people don't feel like they've got to scramble, but they're ready for that conversation. And last, but absolutely not least, as you've heard throughout my portion of the presentation, this budget model is reliant on min choices. And we are going through a pretty big change with min choices here coming up in a little bit. And so for us, we're going to have to pause and rework our budget model based on the min choices revision changes, as well as all of the other changes that our system has undergone since 2019, which I don't know about you, but I would call significant. So that is work yet to come. We can talk about that in our timeline discussion a little bit later on. But overall, I want to highlight that these are the really big things that we're working on. Next slide, please. So what work have we been working on in the last year? A lot of it is around that policy development and making sure that we at DHS have a good enough understanding to start to prep those trainings and those manuals and the documents, as well as the tools that'll help support this transition and new system overall. So we, in the last year, have developed a framework on how to monitor waiver spending and work with our lead agencies on compliance around individual budgeting. We've done a lot of collaborations and conversations to understand how to partner with our lead agencies to make sure that they're ready for this transition. We've started looking at and mapping out how we will change those systems, like I just talked about in the last slide. And then something that isn't maybe as flashy, but is a really important piece is we've initiated the work to develop evaluation and analysis that'll support the disability waivers into the future. So when we say that, really what we're looking at is making sure that we have a good enough understanding of our programs today and where we're going in the future so that we know and can track over time, not only how we're doing, are we meeting our goals, but maybe where do we have gaps and we have improvements. And so that's something that as we look at this big change, it's really important for us to set up. So we're looking forward to that work going into 23 as well. Next slide, please. So just to finish us up on individual budgeting, what we're looking for next year and this year, really, I guess it's January, isn't it? Is more of the same. We're looking at more of that policy development, creating the rules, engaging with stakeholders on those things that we have mapped out to make sure that we aren't missing something from our DHS lens, whether that be lead agencies or families, provider partners, and advocates. And then later in 23, we'll also be starting to dive into some early review of the Min Choices revision launch and the data that we will need to be able to do that recalibration and make sure that our model fits the revisions Min Choices, not just 1.0. So that'll be something that prepares us for the work going into 2024 as well. I think next slide is up, and that should be Leah.
Yep, thanks, Megan. This is the some of the discussion that we've had earlier and throughout the presentation around our work plan and, starting now through 2026. So just to reiterate for this, 2023 includes Min Choices revision launch, policy development, and continued stakeholder engagement. In 2024, we plan to refine and finalize policy, drafting our waiver plans to the federal government for our 2 new waivers and sunsetting our existing waivers. as well as gathering updated data from MinChoice's revision for budgeting purposes. In 2025, we will continue to analyze MinChoice's and MMIS data to recalibrate budgets. We will also prepare the waiver plans for submission. And then in 2026, our goal is to launch Waiver Reimagine January of 26, and it will become available. The system will change as people are reassessed, and so it'll be on a rolling basis throughout the year. Next slide, please. So we're getting a lot of questions, as you can imagine, but we wanted to cover some of the frequently asked questions that we receive from lots of different places and point you to the resources that you can continue to go to receive some answers to your questions. So the place that you can go is the Waiver Reimagine FAQ page. And so we'll get that link to you, but you should also be able to find it in the presentation when that's posted. I'm just going to go through a few FAQs related to reshaping the waivers, and then Megan is going to talk about some frequently asked questions related to individual budgets. And if we still have time, we will verbally respond to some of the Q&A that has come in today, but we are responding in writing to those, so you have a response. So the first question is, would someone still need to meet current level of care eligibility requirements during the transition to 2 waivers? And I think I did cover a bit of this earlier. So people will still need to meet current level of care eligibility requirements. This process won't change. Once we determine they're waiver eligible, so the waiver eligible, not that they're DD waiver eligible, but they're waiver eligible, people will be determined their service needs then and which waiver they're on through an assessment process, the informed choice process, and through that their living arrangement will be identified, and that will in turn determine which waiver they're on. So that will determine if they're on waiver 1 for people who live in their own home or family home, or waiver 2 for people who live in provider controlled settings. The next question is also related to eligibility. If eligibility requirements don't change, how will the transition to 2 waivers simplify the work of assessors and case managers? Today, eligibility requirements do not align between the waivers. So for example, the DD waiver has a residential habilitation requirement that does not exist on the other 3 disability waivers. So moving forward, the waivers will use a single set of eligibility requirements. The single set of requirements is designed to be more easily understood by the people we serve. For people, everyone will need to meet one of the existing levels of care, have needs that exceed the state plan services. Question number 3 is related to case management. Will the roles and responsibilities of waiver case management be affected by the transition from 4 waivers to 2? So the federal and state case management requirements will largely remain unchanged as a result of Waiver Reimagine. Transitioning from 4 waivers to 2 waivers structure doesn't change the roles and responsibilities of waiver case managers, but we do need to think about and determine standards, qualifications for case managers, because they are different on every waiver right now. So how do we work with that in this more streamlined, consolidated service system? Next question, will there be any restrictions on when or how many times a client may switch between waivers in a given year? No, the answer is moving between waivers will be based upon the person's chosen living arrangement. A person would switch waivers when their living arrangement changes. And the last question, as far as FAQs goes, before I move it on to Megan, is, will the new process for moving people between waivers result in wait lists? And the answer is the only time at this point that we are anticipating wait lists would be if there was a legislative action to do so. So we don't intend to have there be a wait list with the process of moving between waivers, but if there is legislative action to do so, we need to follow that legislative action. So again, the FAQ page will have the PowerPoint available on our DSD training site. There was a link to that shared in the Q&A earlier. So you should be able to link to the FAQs, and we'll try and put a link in there in the Q&A to the FAQs right now too for you. I'll pass it along to Megan.
Perfect. Thank you, Leah. And I want to recognize that it's 1:55, so we really are running short. I'm going to cover our frequently asked questions as quickly as possible. I think we are going to run out of time to be answering questions verbally. I will say the team's been doing a great job of answering things in the Q&A, so you should be seeing things that have been answered as we go. Lots of really good information in there as well. But to talk a little bit more about the frequently asked questions we get in budgeting, and I'll say, as Leah was presenting, I was looking at some of them and I'm seeing these questions pop up in the Q&A as well. First and foremost, why move to individual budget? Is it to save money, right? Two questions, but I'll answer them together. The short answer, of course, is no, this is not to save money. Our charge from the beginning of this work and what we are slated to do under the legislature is to keep spending where it is now or where it's forecasted to be. Now, that doesn't mean that there won't be changes. For example, under the model we have today, in people who live independently see just above about a 10% increase in their spending capacity. So things can change in between where people are spending or how they may be spending. But overall, this isn't to save money for this program. It is to shift us into a more financial equity model. This is something that the legislature asked us to start studying back in 2017, looking at an individual model. And from what we found and the feedback that we have been getting from people is that, you know, again, whatever door you walk into can make a big difference. And we wanted to create a statewide look at how people access their funding and can be supported in an equitable way across the state. Second really big question we get, what will my budget be, right? And I want to highlight that when you are looking at these documents on our website, those numbers are 2019 or older. So if you think about how much your own plans or rates have changed in that amount of time, it is a pretty big jump. So those numbers may seem small to you. But ultimately, we do not have a way to hand out people's individual budgets at this time. We can, you know, talk about it. You can estimate where you think you might be, but ultimately we do not have a mechanism with which to say, hello, person who just emailed me, here's what your individual budget would be. So apologies, we would love to be able to do that. And that leads me to the next question, which is, will I get to know my new budget ahead of time, maybe a year in advance? And as our timeline is right now, it's pretty tight. We would anticipate finishing up the recalibration, the resetting of those budgets in early to mid 2025. So we're still looking at a way to get that new information out to people prior to 2026. But as of right now, today, we do not have a way to do that or have it built in. So we're trying to create more transparency and continue to look for that opportunity. But right now, that is not going to be an option that we have. Next question, which I've seen pop up in the questions a lot, which is, what if my budget isn't enough to pay for my support needs? And that's a big question. And I think it's one of the bigger concerns we hear from people. What I will say is, while we talked about, right, this isn't to save money, it is shifting money around in different lanes of services or how people may utilize or access services. But ultimately, with our modeling, we've seen about 85% of people on the waivers today will have budgets that are equal to or more than the spending that they have on the waivers today. That doesn't mean that that's everybody, but it's a good, fair amount. And then we go into, well, there is still that 15%. And we're looking at ways to minimize that disruption for people. Of course, as we talked about earlier, budget exceptions will be an option for some people. There's also the opportunity to use more state plan services if those are within, something that you can access. Also looking at some creative ways to access outside of the budget services as well. So more to come on that. But that's a big thing we're working on with our lead agency partners, and how do we support case managers to plan and to find some creative ways, or to find ways that maybe we haven't worked on in the past to meet people's support needs. And the last question I'll tackle today is, I have a rate exception today. Will I still be able to get a rate exception in the future? And the anticipated answer for that is yes. We don't anticipate, sorry, using that word a lot today, but we don't anticipate any changes to the rate exception process as it is today for the disability waiver rates system, or DWRS. However, as we are planning and working on the policy to support budget exceptions, I will say we're working hand in hand with the team that does rates here in the Disability Services Division to ensure that we aren't necessarily creating any barriers that didn't exist for rate exceptions in the future, and making sure that when someone has a rate exception, if a budget exception is necessary, that there are pathways forward for that. So lots of options there, but I do see it's 2:01, so I want to go to the next slide really quick. Here are our resources. Like Leah and Adrian have both said, this will be posted on the DSD training website. I think we're going to try to get this into the Q&A for everyone as well. But I'll say, even the tried and true Googling Waiver Reimagine Minnesota, you're going to come to our website. So please feel free to do that. And our email, if you need to reach out and ask any clarifying questions, is right there as well. But I will sign us off and say thank you from the team. Thank you for everyone being here. I do think we might have broken some webinar records today, but we appreciate your time and hope that this was informative and helpful for you.